Okay, so let's get into this information in today's episode. Today we're going to be talking about the perfect running form. And this is a question I would get all the time from patients. Runners would ask me, what's the perfect running form? What is the perfect running form I should shoot for? Is there a perfect running form? And they'd always be curious to compare what they've read or what they learned previously or what maybe a coach had told them to what I was suggesting to be their new form or what I thought was the best running form for them. So today we have a lot to discuss in this topic. It's an in-depth topic, and believe it or not, it is something you will hear. You will get asked, what is the perfect running form? And as a lot of PTs know, and a lot of people know, there is no real perfect running form. Now for me, I certainly had an experience early on when I started running. I had a high school coach tell me, Justin, I want you to run a certain way, and it usually came out like this. Running on your forefoot, running leaning slightly forward, leaning as if you were falling forward while you ran, running at 180 steps per minute, and making sure that you didn't go up and down too much while you ran. And there's a lot of those things that could be beneficial for people. However, for me, after a lot of injuries and after seeing a lot of runners and giving advice to a lot of runners, and then ultimately after doing a lot of research and starting a running gait analysis clinic, I personally found, and many people know, there is no running form that's perfect for everyone. There is no cookie cutter, off the shelf, perfect running form because everyone has a different anatomical makeup. Everyone has a difference to the way they run that's very slight. Different people use different shoes. And there has obviously been injury sustained by certain individuals or risk factors that certain individuals have that might preclude them from having or using a certain running form or may dictate they use a different running form. So when we talk about pairing the correct running form to the individual runner, we think of a lot of different factors. So we think of what are their anatomical makeup. Now, as a good practitioner in doing a running gait analysis, oftentimes we'll do a postural evaluation. And just from a posture evaluation, we can see, does the patient or runner have flat feet or high arches, or do they have a predisposition and have genu valgum or genu varus? So there's a lot of different things that we can see. Additionally, it's always important to take an in-depth history from your runner. Do they have previous injuries that they've sustained? Do they have a lot of ankle sprains, for example? Or does the runner have a history of patellofemoral pain syndrome or hip pain? Or maybe they have low back pain, maybe a disc herniation. So there's a lot of considerations to think of, and it's only when we think of those considerations that we then compare the right running form with the right individual. So really, there's kind of two categories we think of when we think of pairing the right running form with the right individual. And I won't really talk too much today about the third, but I'll give you the two and then briefly mention the third. So the first consideration we think of is an injury. If a patient or runner has an active injury or a previous injury, we always want to consider that when talking about the perfect running form for them. And I say perfect running form for them because it's specific. Everyone has a different perfect running form. Additionally, what are the anatomical risk factors that that patient or runner may have? For example, do they have a limitation in their rectus femoris length? Or do they have a lateral tracking patella? Or do they potentially have a shortened gastrocnemius, and that's going to result in them not being able to have terminal hip extension? Whatever those limitations are, whether it's range of motion or stability, maybe they don't have enough quadricep strength or calf strength, or they don't have enough hip abduction strength or gluteus medius strength. So all of those factors can help you decide what is going to be beneficial for that runner. So to recap here, we're thinking not only about the injuries or previous injuries the runner may have, but what are the anatomical risk factors that may create an injury down the road, or might be a risk factor for them to not run correctly or to not run with the right form. So as we talk about that, we really want to get into some of these common injuries and the common anatomical deviations or limitations runners may have. And I want to go over these today with you so that you can start thinking about these and then pairing them with the runners to be able to get the best running form and suggest or recommend the right running form for each of these runners. And I briefly mentioned that there was a third consideration to think about when talking about the right running form. That third consideration is really speed, efficiency, how fast the runner can run, running economy, and we will briefly go over that. However, I will tell you in short, the speed and economy and the running efficiency, if you are giving a runner the right running form that is good for their anatomical makeup and is the right form for maybe an injury that they're sustained, that should cater to them having a more efficient running form. That should cater to them running faster. Running safer doesn't necessarily mean you're running slower or that you're running without an efficient running form. However, I will say the opposite direction, and that opposite direction is that you can recommend a patient or runner to run very efficiently and very unsafe. I think back to my example of my coach telling me to run on my 4 feet, telling me to run as if I was falling forward while I ran, and also trying to run at 180 steps per minute. And I can tell you, after some patellofemoral pain syndrome, after some IT band syndrome, after using some minimal shoes that didn't work out for me, yeah, I was searching for a different running form. Part of which led me to find the world of running gait analysis to learn more about how I could correct these things and keep running without pain. Story for a different day. So when we think about pairing the right running form to the right individual, let's start with running related injuries. And common running related injuries that many of us know, but I'll go over right now, are going to be things like patellofemoral pain syndrome, are going to be things like an Achilles tendinopathy, are going to be injuries such as knee osteoarthritis, and there's many, many more. Obviously, a lot of these can be impacting a runner and impact the longevity of that runner. In fact, another one that comes to mind, medial tibial stress syndrome, or shin splints, is a very, very common running injury. And on a whole, there's some exceptions to the rules, which we'll talk about, but on a whole, a lot of the running related injuries are going to be related to the impact sustained through the runner's lower extremities as they hit the ground reaction force. And so the increase in that ground reaction force or the repetitive strain on the runner can cause a lot of these injuries. So there's some running forms that increase the impact through your lower extremities, and if we can avoid those things, it can improve this pain a lot. I have personally seen this with patellofemoral pain syndrome, recommending a different running form, and seeing that pain pretty much go 100% away. In fact, I think for that patient I'm thinking of, it went 100% away. So when we talk about running form as related to these injuries, a lot of the running form we want to avoid are excessive impact or heel strike at initial contact. We want to be very, very careful with how much overstriding the patient or runner is doing, meaning how far your foot is coming in front of the hip and landing way out in front of the hip while you run. Think about the farther the foot lands in front of the hip, the more you're essentially braking and holding yourself back when you're trying to run forward. So that can create increased ground reaction forces impact through the lower extremities. Another factor to think about is how much dorsiflexion the patient has, and also how much impact is going through the body just based on the position of the trunk. Is it leaning forward? Is it leaning back? So those are important considerations to think about, especially while you're running. Now, I mentioned Achilles tendinopathy earlier and Achilles pain. I also mentioned gastrocnemius strains and soleus strains. those are going to be a little bit different. And I said there's always exceptions to the rules. So for a gastrocnemius strain or an Achilles strain, in this case, you would want to encourage that runner to actually not as much land on their heel, but land a little bit more midfoot, slightly, to try to get the pressure off the heel. So still, a heel strike is indicated, but we don't want to totally get to a midfoot strike. We don't want to totally get to a forefoot strike for sure, because the more they're on their forefoot, the more that Achilles is going to be tensioned, and the more they're actually going to stress that calf or Achilles structures. So to recap with Achilles, again, we want to limit how much heel strike that they're doing, but we don't want to get them all the way to a midfoot or a forefoot strike for sure. Now, let's talk about some of the anatomical considerations that can be important when thinking about a running gait analysis or thinking about the correct running form. So especially considerations for anatomical risk factors, a lot of these would be things like you want to be very, very careful about a midfoot or forefoot strike. You want to be very, very careful with a narrow base of support or the feet kind of crossing over each other when they run. And then things like an elongated stride length and running at a very high speed are all things you want to think about. And if you see on a running gait analysis, you want to be wary of. And then if you test those muscles, if you test out the patient and they're fine, then okay, not a problem. However, the things I've brought up here, and in this category, the heading is high instability and high strength forms that oftentimes cannot be performed correctly because the patient just doesn't have the strength. For example, if you're going to be running midfoot or forefoot, it is very, very hard to stabilize your foot and not overpronate. It's hard to not do valgus collapse of the knee, and it's hard to not have some hip drop with that. Landing on the heel slightly allows for the arch to load. It adds a lot of stability in your foot, and it creates much more stable running. Now, some patients can run midfoot, forefoot without a problem, and they have no deviations. I am only saying that a lot of runners have these deviations with a midfoot or forefoot strike. Additionally, that elongated stride length makes it harder because you're now putting more force through each step. And that elongated stride oftentimes is not done correctly. People will say, I want to elongate out my strides or get to that 180 when I'm really at 190 or even plus over 190. So you have an elongated stride, and that's causing either they don't have the strength, they don't have the length, or they're forcing it, and now it's causing more problems. And obviously running at a high rate of speed can cause more stress because you're now requiring your muscles to do more. So really, really think about the strength the patient has and the range of motion. One of the last examples here, and this is a little bit of an example against the rule I've been telling you, is a shortening of the rectus femoris or a limitation in the mobility in your rectus femoris. When you're running, if your rectus femoris is tight, you would think, well, then we don't want to extrapolate and ask the patient to go into terminal hip extension or increase terminal hip extension while running. Well, actually, while running, if you're increasing that terminal hip extension, it can actually promote increased rectus femoris strength, length, and it can also promote gluteus maximus strength as well to be able to decrease that deficiency. You want to be careful they're not hyperextending their back. You want to be careful they're not lacking core strength, and you want to be careful you're not doing an anterior pelvic tilt here as well. So as you can see, there's many guidelines here to follow to help patients and runners get the right form. And you can also see that I keep talking about some of these exceptions to the rules. And that's why it's so important for physical therapists to really apply their clinical reasoning here, to really provide the best information and the best data for patients to be able to make sure that they're running safely. Additionally, it's also really important that clinicians use their critical thinking and their clinical reasoning, clinical decision making, to be able to take some aspects from maybe an injury that's going on, or maybe take some aspects from some anatomical deviations that are going on or limitations, and combine that together to find the right running form for every single individual. And it's a hard process. You start to see runners and you start to see people, and you start to get more and more comfortable with being able to advise the right running form. Some runners will be able to adapt very quickly. Some people you'll find you want them to do this running form, they just can't do it. So then you have to work on the strength and the mobility and maybe some follow-up PT sessions or whatever it is. And it's a vast topic, so I will say, if you do have any questions, feel free to reach out to us. Feel free to ask. Feel free to just talk to us about SHOP. We love this stuff. And if you do reach out, we'll make sure to get back to you, talk to you about what your question was, or maybe the topic you wanted to discuss, maybe that sticky runner that you've got that you can't figure out the right running form for, and discuss it through together. There's a lot that you can find in this topic, and obviously this is a topic I'm passionate about. So I look forward to seeing great running form. I wish you the best of luck getting the right running form for your patients and runners, and make sure to check out some more of our information that will be talking about running form, and we'll be talking about correct running mechanics as well. Thanks, and have a great day.